Hello everyone, my name is Light Amedzekor. I'm from Lucent Vision. I have the pleasure of speaking with Dr. Suzanne today. She's a very great friend of mine, a mentor, and she's been working for Lucent Vision, supporting our dream, since the foundation of this organization. So please welcome Dr. Suzanne. Dr. Suzanne.
Hi, I'm Dr. Susan
Nice to meet you.
Same here.
Great. What is diabetes of the eye?
Okay. Diabetes, unfortunately, is the #1 cause of new blindness in the United States.
Okay.
Diabetes is a disease of small blood vessels throughout your body. So some of the smallest blood vessels in your body are in the retina, the back of the eye.
Okay.
What's happening is instead of the blood vessels being a nice smooth tube, they become very leaky.
Okay.
And they leak blood, or they leak hemorrhage. When you leak blood into the retina, you disrupt the retina, so it doesn't see correctly.
Okay.
The problem is, once that happens, it's very difficult to fix that. So once the retina experiences hemorrhage, it's very hard to clear it up so the patient will see correctly. We normally see bleeding in the eye after about 10 years or so of diabetes. Sooner if you're poorly controlled, and you may get a little longer where you don't have a problem if you're well controlled.
Okay.
And the control with diabetes is keeping your blood sugar low. All right, so not just sweets, but carbohydrates play a huge role. And exercise and watching your diet are the key with controlling diabetes in general.
Great. So the doctor is emphasizing that what you eat can actually have an impact on having diabetes or having diabetic retinopathy. So Dr. Suzanne, can you please tell us how diabetes is detected, and are there any symptoms to it?
Actually, yes. Diabetes in general, we call it the 3 Ps: polyuria, polydipsia, and polyphagia.
Wow.
Patients will complain that they are eating a lot, drinking a lot, and running to the bathroom.
Oh, wow.
So if you have those symptoms, you tell your general doctor, who will then test your blood. They take a small sample of blood to see how much sugar is in the blood. Okay. And if the sugar is at a high level, then they will do further tests to see if your body's metabolizing the sugar correctly.
Okay.
So there are certain criteria for diabetes. If you have repeated tests that show your sugar is high, they will in fact call you diabetic. Sometimes you can control it through diet and exercise, and that may be all you need. And sometimes we'll have to start giving you a pill to help you process the sugar in your blood. Really severe type 2 diabetes, which is the adult form of diabetes, will occur in patients that are overweight and who don't follow a dietary restriction.
Right.
They sometimes will go on to need pills and insulin injections.
Okay.
The symptoms are usually these patients that come in eating a lot, drinking a lot, running to the bathroom, urinating frequently, are usually not feeling well. Right. So they'll come in saying, I just don't feel like myself. So if you're not feeling well and you have those symptoms, you should get checked. Okay. As far as your vision, the vision is only affected later in the disease, but as I said before, the #1 cause of blindness. Now, it's preventable blindness in that you need to get your eyes examined, right, and not just an eyeglass check. People with diabetes need their pupils dilated. When we put a drop in the eye and open the pupil, the black circle up, it lets the doctor see your retina from edge to edge. Okay. And we're looking for any type of leakage of blood. Because if it's leaking in your retina, the leaking is going on in your brain, your kidneys, your liver, everywhere in your body. Okay. It's just we are able to see into the natural setting of the eye because we have a clear window in. Right. So we can see the blood vessels pumping blood and leaking blood if that's the case. And we know that what goes on here is going on elsewhere. So it's a very good way to detect this problem.
Great. So who are more predominantly affected, or who is more of a risk to getting diabetes?
Diabetes in general is anyone that is overweight, anyone with a family history of diabetes. I believe it's equal among all races and all age groups. It really is more dependent on your lifestyle. So if you have a lack of exercise, a diet high in carbohydrates, right, and you're already overweight or obese, you are at high risk for diabetes.
Great. So what advice would you give to the public of how to prevent diabetes?
The same thing your doctor will always tell you. Eat well, eat right, sleep well, exercise, hydrate your body, drink plenty of water, not soda, not juice.
Yes.
And the key is watching your intake. You know, the food pyramid, make sure you have food from every food group and not just high in carbohydrates, fats, and sugars. All right? You've got to spread it out amongst all the different food groups so that you're eating a more healthful diet.
Very good. Thank you, doctor.
Anytime.
Thank you so
much. It's been a pleasure. Good luck.